Hello there, welcome back to Coco Campus. Today, let's study about the muscles present on your upper arm, an Armageddon. If you want to understand the arm, stop thinking of it as a tube of meat. Think of it as a two-room apartment separated by walls called intermuscular septa. The front room, the flexors, the BBC. B stands for biceps brachii. The next B stands for brachialis, and the C stands for coracobrachialis. And on the back room, you have the extensor muscles, the triceps, on the posterior side. Now, let's cover every origin, insertion, and clinical death trap examiners love. Let's dive in. Room 1, the anterior BBC. Here, the muscles are the flexors. The first muscle is your biceps brachii. Or should I say, the show off muscle. Its origin is of two connections. The first, short head, coracoid process of scapula, and long head, supraglenoid tubercle. Now, something interesting. This tendon travels inside the joint capsule. It's very high yield. Then you have insertion, where the muscle ends. It ends on the radial tuberosity. And the bicipital aponeurosis as well. Which nerve gives life to this muscle? It's the musculocutaneous nerve. What does it do? What's the action? It's the corkscrew muscle. It supinates the forearm first, then flexes. So, the primary action is supination, and the secondary action is flexion. Let's move on towards the next muscle, the brachialis muscle. It is the workhorse muscle of the body. When it comes to your upper arms, its origin is the distal half of the anterior humerus. Distal half of the anterior humerus. Next up, let's look at the insertion, coronoid process, and ulnar tuberosity. So, brachialis has two insertions, which is the coronoid process and ulnar tuberosity. It's basically one big insertion, think of it that way. Then, you have the action. What does this muscle do? It is the purest and most powerful flexor of the elbow. Yes, it's not the biceps brachii, it's the brachialis that is the purest and most powerful flexor of the elbow. Now, here's something interesting. It has dual innervation, which means two nerves. Most of it is musculocutaneous, like two-thirds. But the lateral part is innervated by the radial nerve, C7. So, if there is a question that asks for dual innervated muscle in the arm, guys, this is it, the brachialis. Let's move on towards the next muscle. Next, we have the coracobrachialis muscle, or should I say the landmark muscle. The origin is the coracoid process, just like the name said, coracobrachialis. So the origin is the coracoid process. Let's look at the insertion. It is the middle third of the medial humerus. Now, what does the coracobrachialis do? Its action is that it flexes and adducts the arm. Adduct means addition towards the body, which means added towards the body, which means moved towards the body to the medial side, right? Then, let's look at the clinical significance. The musculocutaneous nerve pierces this muscle. So, when you look at videos of cadavers, or if you see a cadaver in live situation, you should see that a nerve stabbing through a muscle. Now, that is the GPS for your coracobrachialis. Alright, so it basically pierces this muscle. Moving on, let's go to the to the posterior side, the powerhouse muscle. Turn your arm around. Look at that big, huge muscle present there. This is the posterior compartment and it is home to the three-headed monster, your triceps brachii. Just think of this. Radial is for reaching, which means RR. Radial is for reaching, which means extension. So its innervation is the radial nerve, C6 to T1. Now, let's look at the origin. It has three heads, like the name suggests, trifoot tree, right? So, three heads. The long head, its origin is at the infraglenoid tubercle. This is the only one that is actually crossing the shoulder joint, and we have two other heads. It has a lateral head and it has a medial head. Both of them are on the posterior humerus. However, lateral head is above the radial groove. Medial head is below the radial groove. So, it's very simple. Long head above the shoulder, infraglenoid tubercle. Lateral head, posterior humerus above the radial groove. Medial head, again posterior humerus, but below the radial groove. Easy enough, right? Let's go on towards the insertion. Insertion is at the olecranon process of the ulna. So, three heads, one insertion. The insertion is at the olecranon process of the ulna. Moving on, its innervation is once again the radial nerve, C6 to T1. Let me just note it down for you so you remember it. Next, what does this powerful muscle do? Just as I said, this muscle is powerful. The same way, its extension is also really powerful. This is a powerful extension of the elbow. That's what this muscle does. This is your push muscle. Okay, now let me tell you something interesting. The radial nerve sits directly in the spinal groove. If you break the humerus midshaft, you crush this nerve. Okay, now let's go on to what's in next. We will talk about fracture site, which nerve is at risk, and what exactly happens. First, the surgical neck. Here, the nerve at risk is axillary nerve. And the deformity is flat shoulder. You can see a flat deltoid muscle there. Then you have the midshaft fracture site. Here, the nerve at risk is the radial nerve. You can just understand that the extensors are dead. Then you have the supracondylar fracture site. Here, the median nerve is at risk. And you can think of the hand of benediction when they try to make a fist. You see the hand of benediction as a catchy deformity sign. Also, there is medial epicondyle fracture. This one hits the ulnar nerve, which leads to claw hand. Alright, think of it like this. The arm mnemonic, ARM. A stands for axillary, R stands for radial, and M stands for median. So axillary is at the top, A at the top, R is midshaft, and M is towards the distal side. So ARM, axillary, radial, median. Median is at the distal side, axillary is at the proximal side, and radial is at the midshaft. Simple. Okay, quick recap. BBC, musculocutaneous, but brachialis is a double agent with the radial nerve. Triceps, radial nerve. Deltoid, axillary nerve. And if the humerus breaks, remember arm, axillary, radial, median, top, middle, bottom. Alright, I hope this was really helpful for you, and I'll see you again soon with another interesting video. Take care.